So today I'm going to be doing the IV flush and the IV piggyback. So the first thing I'm going to do is review the physician's orders and look at what I'm needing. And then I'm going to gather my supplies. So the first thing I'm going to be giving is furosemide 30 milligrams IV push. So I'm going to go ahead and pull that from the cart and I would do my first safety check. So I have the right time, 6 a.m., the right date, 9/13/21. Indication, I have the right patient, Bud D. Johnson. I have the right drug, furosemide injections, 40 milligrams per 4 milliliters. And then I will document at the end. Also grabbing this, I'm going to go ahead and do my math. So I see he needs 30 milligrams of IV push, and I have 4 milligrams per 4 milliliters in my tube here, so I'm going to be pulling out 3 milliliters. I'm also going to be grabbing 2 flushes to give, so I'm going to do my first med check on those. So I have the right time, the right date, indication is flush, my patient's Bud D. Johnson, my drug and dose is just sodium chloride 0.9%, 10 ml syringe for both of these. And then I'm going to make sure, I'm going to go over and do my piggyback. So I'm going to make sure I have the correct tubing. I'm going to go ahead and pull my med from the cart and do my first safety check. So again, I have the correct time and date, the right indication, my patient's Bud D. Johnson, my drug is cefazolin injection, 2 grams per 100 milliliters, and I'll document at the end. And then also I'm going to be checking both of these for any holes in the bag, anything floating. I'm going to check expiration dates to make sure that everything I have is up to date and it's all good to go and clean. So once I do that, I'm just going to check over Bud's allergies to make sure nothing is that he's allergic to that I'll be giving him. I'm going to check compatibility if anything would be running together. And then I would check the rate of the push rate for the furosemide, which I will push over a minute. So once I have that done here, I'm going to go ahead and I'm going to draw up my furosemide. So now that I'm doing that and about to draw it up, I'm going to do my second safety check. So again, I have the correct time and date, indication, my patient's Bud D. Johnson. I have furosemide 40 milligrams per 4 milliliters, and I will document at the end. Again, my math comes out to say that I will be drawing up 3 mils in my syringe. So I'm going to perform hand hygiene just before drawing it up. So I'm going to wash my hands. I'm going to take my alcohol swab. I'm going to clean the top for 10 seconds. Alright, I'm going to attach my needle to my syringe. Again, I'm drawing up 3 mils, so I will be injecting 3 mils of air into the vial. Alright, and once I do that, I'm going to flick the syringe to make sure I get all the air bubbles out. Again, double checking my dose to make sure I have the correct dose before I go into the client's room. I'm going to go ahead and pull it out and I'm going to swoop up my cap. Okay, now that we have that ready, we can go ahead and get ready to go into the room. And as soon as I draw up my furosemide, I'm going to take my label here and I'm going to label my syringe so it has the correct dose and the correct med that so I know which is which. All right, now that I've done that, I can go ahead and enter the room. All right. Knock, knock. Hi, my name's Cassie. I'm going to be your student nurse today. Can I have your first and last name and your date of birth? All right, and I'm going to double check that with my physician's order to just make sure that I have, again, the correct patient. I'm going to go ahead and wash my hands. All right. right, bud, do you have any allergies or anything I can be aware of? All right, sounds good. Well, I'm gonna go ahead and give you some medications today. So now that I am at the bedside, I'm going to perform my second safety check on both my saline flushes and my cefazolin injection, or my bag. So again, I have sodium chloride, correct time, day, indication. My patient is Bud D. Johnson, matches his wristband. My drug and dose, sodium chloride 0.9, 10 mils. Again, I did my second safety check when I drew this up. For cefazolin, I have 2 grams per 100 milliliters cefazolin injection. I have the right date, time, indication. I have my correct patient, and then we will document at the end. All right, bud, I'm gonna go ahead and give you some medications here. So the first thing I would want to do would be to just look at the IV site and make sure that nothing's dripping, or that it's not out of place, or that I'm not missing anything. All right, bud, we're gonna go ahead and give you that first medication here. So I'm gonna go ahead and stop what he currently has running. All right, so I'm gonna grab my first saline syringe here. Now that I am going to give it, I'm gonna do my third safety check. So again, time and date, 6 a.m. on 9/13. My patient, Bud D. Johnson, drug and dose, sodium chloride. And then I would do my third safety check. I have labeled my furosemide 3 mils, going to match that with the physician's order. Okay, now that I have paused that, I'm just gonna get my stuff set up for preparation here. All right, so I stopped what he currently has running. I'm going to go ahead and remove the current line, and I'm going to put the sterile cap on top of it while it is waiting. All right. So I'm going to scrub the hub. I'm going to attach my sodium chloride, and I'm going to pull back to make sure that I draw blood, to make sure the IV is patent. Also, I'm going to be looking for swelling or anything that's abnormal to the IV. So I'd go ahead and inject my sodium chloride. All right, that looks good. I'm gonna go ahead and scrub the hub again. I'm going to remove my needle and dispose of that in the sharps container. I'm going to connect those two together, and that I know that this particular med needs to be pushed over a minute, so I would slowly inject over a minute. Once that minute was up, I would undo my medication, set that to the side. I'm going to take another clean wipe, and I'm going to scrub the hub. I'm going to take my second saline, I'm going to attach it, and I'm going to slowly flush the second syringe, just because there's still medicine in the tubing, so I want to make sure that the flush is slow since he's still receiving medication. So once I slowly flush that, I can go ahead and disconnect. I'm going to take my clean wipe again, and I'm going to scrub the hub. I'm going to remove my sterile cap from my tubing, and I'm going to connect the tubing back to the IV site, and I am going to start up what he has running already. And then I would document how much sodium chloride I gave, what medication I gave, how much medication I gave, saying it was IV push. I also checked for compatibility before I gave it. So I would document that. I would document IV site if there's any swelling, how the patient took the medication, if he was having any pain or having any weird feelings with it. And that is that. All right, bud, we're gonna go ahead and give you your piggyback medication. So I did my second safety check at the bedside when I did the furosemide. So now that I'm going to hang it, I'm going to do my third safety check. So again, I have the correct time, the correct date, 9/13, indication. I have Bud D. Johnson here. We checked over his allergies, and I have 2 grams per 100 mils, meaning that I'm going to set, I know that what I'm going to set my rate at, 200 mils an hour for 30 minutes. All right, so now that I'm over here, I have my correct tubing. All right, now that I have that, I'm gonna make sure that the roller clamp is closed so that nothing leaks out. I'm going to remove the cap, and I'm going to remove this cap, and I'm going to spike the bag while being careful to go straight down so I don't poke myself. Flip it over, and I'm going to fill my container halfway full. And while doing that, I'm going to undo my roller clamp and let it leak out the bottom so I know there's no air bubbles, and then we'll go ahead and close the roller clamp back up so it doesn't keep leaking. So now that I've done my third safety check, I have this filled. I know there's no air bubbles in here. Again, just double checking to make sure there's no holes or nothing floating in my bag, just to be extra safe and extra cautious. All right, bud, we're gonna go ahead and get you set up here. All right. So I have my physician's order here. I'm going to go ahead and hang this. Just making sure I still have the correct medication, I have the correct tubing. I'm gonna go grab my wipe, and I'm going to clean the blue cap here. And I'm going to screw my piggyback on. And I will undo my roller clamp, and then I'm going to set up my machine here. All right, so I'm gonna go ahead and click on B, since we're gonna be running through the B. It's gonna be piggyback. The rate, I'm double checking, so we need to give 2 grams every 8 hours for over 30 minutes. And my bag here is 2 grams per 100 milliliters. So I'm gonna be running it at 200 mils an hour. I'm gonna go down to duration. Again, double checking on my MAR. We're giving over 30 minutes, so I'm going to enter 30 minutes. And then I'm going to go ahead and click start. And then it would be running piggyback, and I'm going to take my label here that says cefazolin, and I'm going to hook it on to my secondary tubing. Once I do that, I'm going to clean up my area. All right, bud, is there anything else I can do for you today? All right, sounds good. Well, I'll be back in about 15 minutes or so to check on you. Here's your call light if you need it. I'm gonna put your bed all the way down to the floor, and just let me know if you need anything. And I would go ahead and wash my hands. And then after I do everything, I would take and I would go document how much sodium chloride I gave, how much furosemide I gave, and how much cefazolin I gave, where the side of the IV is, if how the rate that it's running, if the patient had any reactions to it, or if it made him feel any type of way. I would say that it's infusing, his cefazolin is infusing by pump and not by gravity. And then just document the whole procedure and everything that happened, and when he would need follow-up and everything like that.